Hello and welcome. After the initial jubilation on the 21st of June, when India made global records with the highest single-day vaccinations, now 3 weeks later, here's a reality check. There's a worrying drop in vaccination rates across India. Take a look at this. On the 21st of June, India administered over 86 lakh anti-coronavirus jabs in a day. But in a little over a week later, the last day of the month, on the 30th of June, India administered just 27.6 lakh jabs. This month, on the 4th of July, as you can see there on your chart, we administered just 14,81,000 doses, and on the 21st of June, about 86 lakh doses were administered. But the very next day, we saw a sharp drop to about 54 lakh doses. Now, that could be written off as a post-D-Day recovery slowdown, but since then, look at the chart again on your screens. The number of doses goes down further and further. And on the 1st of July, when just 42 lakh doses were administered. And today you have Friday, the 9th of July, where according to the numbers put out on the CoWIN site, only 29 lakh doses have been administered. We are now in the month of July. And this week we saw concerns about a third wave increasing thanks to images all over the news and social media of huge crowds in hill stations as a heat wave grips the north of India. Images of huge crowds of holidaying tourists throwing social distancing norms to the winds at the Kempty Falls in Mussoorie to Manali, completely abandoning COVID restrictions. Now, in the midst of all of this, our vaccination rates have on an average been only in the 40 lakh doses a day range. And on the 8th, that's on Thursday, the latest figures show that only 40,23,173 vaccine doses were administered in the last 24 hours. That is as per the Ministry of Health. And today, on the 175th day of the vaccination drive, on the 9th of July, according to the CoWIN site, only a total of 29 lakh vaccine doses were administered. So the daily average or the average daily vaccinations has fallen sharply. In the week of June 21st, officials all over actually rejoiced when India hit a single day record by administering those, almost 8 million COVID-19 vaccinations. And that week, June 21st to June 27th, the average doses administered was 58 lakh doses per day. Now, in the first week of July, the average is at about 40 lakh doses per day, down by almost 31%. That's if you don't count the last day, that's today, where the latest data has just about come in. That's 29 lakh doses administered today. Over the last 3 days, India has also recorded a spike in the number of COVID cases. This after a lull of 56 days. As of July 8th, 8 to 11 states and union territories across India registered a rise in the number of fresh coronavirus cases. Now, take a look at India's daily cases. They've been falling consistently. They're up till the end of June, you can see, and then starting to fall as July hits. Just around the 5th of July, India reports, if you could zoom into that last bit, the 5th of July, India reports about 34,000 cases across the country. That was the lowest number we had come to in the last week, 34,000 cases. And then the next day on the 6th of July, there's a 10,000 case leap in cases. So it leaps to 43,000 cases, and both on the 7th and the 8th of July, where the number of cases being reported are in the mid of 40 to 45,000 range. Now remember, this also means that this increases the number of daily average doses required to meet the December target set by our government, set by the government of India to vaccinate all Indians by the end of the year, or at least if you want to vaccinate 60% of all Indians, then the vaccination rate required to fully vaccinate all adults by the end of the year is about 90 lakh doses a day. The current average daily vaccination stands at 40 lakh doses a day. That's a shortage of about 50 lakh doses a day. We're almost 7 months short of our target. We have less than 180 days left in this year. And India needs to inoculate 60% of our population by December 2021. If that is our plan, if that is still our goal, if that is still our target, if that hasn't been moved, then at the current rate, it will take almost a year to vaccinate all Indians. And at the current rate of vaccination, we'll hit that number only by July 2022. So why have our vaccination rates fallen? Is this a cause of concern? Should the alarm bells be ringing? Joining us on Reality Check today is Dr. Shahid Jamil, virologist, director of the Trivedi School of Biosciences at the Ashoka University, Professor Rijo M. John, adjunct professor at the Rajagiri College of Social Sciences in Kochi, a guest faculty at IIM Kozhikode. We have Dr. Sunila Garg, professor of community medicine at MAMC, member of the Lancet Commission of the COVID India Task Force. And we have, last but not the least, we have Dr. Om Srivastava, member of the Maharashtra COVID Task Force, consultant of infectious diseases at the Jaslok Hospital. Dr. Jamil, to you first, how do you explain this declining graph now, just as our momentum was starting to build?
Well, on the 21st, as you said, India vaccinated 86 lakh people. So it shows that we do have the capacity to go to that level. So the only explanation for the fall is that supplies are not coming through. And supplies will only come through if vaccine orders have been placed and vaccines have been ordered well in advance, because it takes time to make vaccines. Companies will not make and store vaccines in their freezers unless they have orders. Remember, for Covaxin, which is an inactivated vaccine, where the virus has to be grown under highly contained conditions, a single batch turnaround time is 4 months from start to finish. So I guess we need better planning to make sure that enough doses are coming through.
Or you have to be able to go back in time to be able to place those orders. It's simple demand and supply. You want to order something, you have to give them time to manufacture and produce it.
Absolutely.
Well, so then what happens to states where, like we say, the momentum was building and then there are no supplies? Dr. Om Srivastava, Alpha, Delta, Kappa, now, you know, this coronavirus seems to be ever mutating. When does it end? Perhaps, as the British Prime Minister Boris Johnson had said, we must learn to live with the virus. But that's, I mean, easier said than done. Nations can't remain under lockdown forever. The only answer is to quickly vaccinate as many people as possible. Yet, in comparison with the first week of our new vaccine policy launch, the present rate of jabs is nearly half of what was being administered between June 21st to June 27th. So, Dr. Srivastava, Maharashtra is one of the states facing a shortage.
Very true on all the counts that you have put your question across to me. Thank you for having me on your show. Essentially, look, there are 4 or 5 factors. One is that procurement of vaccine is something that starts when the vaccine starts getting manufactured. Yeah. It's a little delayed to say, oh, look, we are not meeting our targets now, let's buy some more vaccines, because that also takes time. You place an order, the vaccine has not just one component, it has several components that comes from more than one country. And that will take some time to get manufactured, then to come to your country, to get the relevant clearances from the DCGI, other places in your country, and then to be given to those people who, you know, not everybody lives in Delhi and Mumbai and Bangalore. There will be people living in the backwaters of, Kerala, maybe Rajasthan, maybe Uttar Pradesh. So these are the logistics that we probably need to look at. I agree with you when you say that, is it something that we need to live with? You know, is this infection something that is going to be in our lives all the time? Quite possibly, but then it's a little difficult because it has come at a time without any warning that kept us indoors for the better part of the last year and a half. So I can understand that it's not going to be a straightforward kind of suggestion to say please live with it. But be that as it may, vaccination only appears to be the only way where you will be able to combat this. The more you do it, the better it is. Now, as far as the other part that you asked, whether it is the alpha, the beta, lambda, all of these strains, they will keep coming. Yes, it's not going to stop here. The virus is something, it's a small virus. You know, it's the RNA virus in the family of viruses where it will replicate, it will multiply, it will mutate, it will go into different genomic sequencing from time to time. And so you're not going to be getting a grip on it simply by saying that, yes, we've got genomic samples coming from X, Y, Z corners of the country. So there are challenges, there are dynamics that we have no control over. But you've then got to look at what are the things that you are going to be able to, where you're going to be able to make the biggest and the most decisive difference. And to my mind, vaccines, social distancing, keeping an eye as to not allowing mass gatherings if you absolutely don't have to, these are going to be the mainstays of how we are going to be dealing with COVID, depending upon howsoever long it's going to stay amongst us, which may not be any less than maybe a year or a couple of years or 5 years, who knows?
Wow. A scary thought, but so then what's the solution? Because if both Dr. Jamil, Dr. Srivastav, we're all pointing out that, look, we don't have supplies of vaccines. It's not going to be produced overnight. The orders need to, we can't go back in time. So what is the solution? But perhaps first, Dr. Sunila Garg, do we have to identify that we have a problem, or do we need to get different vaccines, other vaccines from other producers, different types of vaccines into the country? Dr. Sunila Garg, first, amidst these reports of shortages in states, the health ministry though seems to keep rubbishing reports of vaccine shortages. You know, you hear statements like we're running a marathon, this is not a sprint, you don't need to look at the minute day-to-day picture, we need to look at the big picture. You hear statements saying like there's really no problem. Yeah, Dr. N.K. Arora, who heads the National Expert Group on Vaccine Administration, just told NDTV yesterday, he told NDTV's Vishnu Som that all of India's adult population will be vaccinated against COVID by December. So is the government in denial? You heard statements like them saying it's aspirational, what they originally said, you know, moving the goalpost.
Thank you, Seda, first of all, for having me on the show. Now, what I'm like to say is that, first of all, we had estimated that in July, we will be giving approximately about 12 crore vaccines. Yes. And then from the mid of August, we will start having more of, you know, Covishield and Covaxin, and along with we will have 4 to 5 million doses of Moderna and Pfizer. And then, you know, after this, gradually we start having doses of, you know, biological E and, you know, Zycovid. That is, these are some of the things which are awaited over a period of time. And the government has also revised the strategy from 200 million in December to 135 million. That is one thing which we need to look at. But you're absolutely right that as of now, this much amount of paste is not going to be sufficient. But along with it, let's say even if the vaccine is available, we still need to strategize. How are we going to do? Like something like some of the states have now started doing house-to-house vaccination, and then they have started looking at super spreaders. That means hawkers and vendors and all are being, you know, vaccinated on a priority basis. But most important is the confidence building, the convenience of the vaccine, and removal of infodemics. And there is also a lot of, you know, divide in the equity also. So we need to look at the marginalized populations as well. That means we have to look at rural, peri-urban and tribal areas also as far as the vaccinations are concerned. And also we need to see that, you know, people come with the confidence. Today also I am watching the different centers, they say that we will give only second dose of vaccine. They're giving only 30 to 40 doses. So that's where we need to look at that in a big center where whole manpower is available, so they can give first dose as well. So we need to strategize our own, you know, strategy with regard to vaccination as well. So wherever the facilities are there, we must make full use of these facilities. But vaccination definitely, along with the strategizing of the, you know, way we do the vaccination is much more important. And we need to focus on
Garg, you have repeated, this is what we're hearing from the government. The government has been saying that, look, this month you were only expecting those 12 lakh doses, but next month it's going to go up. But does that mean we're going to be in time to be vaccinated enough to prevent the third wave, or to at least numb the third wave a bit?
Yeah, Sada, what as a public health specialist, what I feel is that we have got 90 crore individuals as the eligible people, right? And as of now, we have vaccinated 36.89 till yesterday, 36.89 crore. So that means about a third of this. And along with this, we need to also look at how much is our seropositivity. That is also going to play a very, very important role. That means people who have got infected, and we have done the seropositivity. And in some of the surveys, like AIMS did the survey where they found the seropositivity to the tune of 60%, and Delhi also had similar kind of seropositivity. So that is where we feel that, you see, as has been pointed out by Dr. Srivastav and Dr. Jamil also, complementing this will be COVID appropriate behavior, which will play a very, very important role.
Which we're not seeing at all. As you can see, those tourists in states like Uttarakhand, I'll admit, I traveled last month, nobody stopped us. I got myself tested before I went. Not one person was stopped. Everybody is allowed to go into these states. UP is supposedly going to decide to go ahead with the, the Kavariyas. So it doesn't look like any of that reactions are coming in. That's why the question we're asking is, should the alarm bells be ringing? Professor John, when India, it was being said that when this vaccination drive was given a new lease of life, and we had this new vaccination policy when it kicked off on the 21st, when we recorded this 8.6 million doses in a day, was that a premature celebration? And since then, are we seeing reactions from the government to the fact that our vaccination strategy, the momentum is being lost? Where are all those vaccines that we heard the US was sending to India? We only hear of Covishield and Covaxin being administered.
Well, thank you, sir, for having me here. It's a fact that we have drastically reduced the daily average from 64 lakh in the week of June 21st to around 40 lakh right now. Yes. But when you actually look at the total month, I see that the whole of June, our daily average stood at around 40 lakh. And so far in July, also we are holding at 40 lakh. So which means that 1 week of, celebration or whatever you call it, was just, just an aberration from the usual trend that we were seeing. And clearly, before the 21st big vaccination day, we had seen, like on 20th, there were about a stockpile of 3 crore plus vaccine doses available with the states, as per the reports from the government, it's a PIB report itself, which means that these were stockpiled only to showcase a larger number of vaccine inoculations on one particular week.
And
but
similarly,
anyway,
the day after, the 22nd,
exactly.
also we saw a huge drop.
I mean, in fact, that whole week we had a really big number. I mean, it averaged around 64 lakh on that week around. So let's put that aside. Even for the month of July, the government's own submission to the Supreme Court recently says that we have only 12 crore doses available, which means the whole of July, our daily vaccination average is going to remain at around 40 lakhs, and it's not going to go more than that, right? So considering that we need to have 9 million doses per day administered to be able to vaccinate everybody by the end of the year, and considering that we're only expecting a 12 crore in this year, this month, and even the subsequent month as per the available report, we're not really going to be getting as many doses as we actually require even to reach this target. So it's very clear that
18 we're told for next month from September.
Exactly. So vaccine shortage is real. Let's face it, it's real. Now I think the job should be that how we can actually optimize these available limited doses. Are we is our current policy right? I mean, I'm not an epidemiologist. I really can't say who should be administered first. But then I mean, it's fairly reasonable that anyone would agree that the people who are the most vulnerable for serious adverse events if you get COVID, those are the kind of people that should be administered the vaccines first. But unfortunately, even the most vulnerable that the government of India had identified, 300 million people that was originally identified, which the government had 6 months ago said that, we will be vaccinating these 300 million people by July. When you look at the statistics, you can actually see that only about 50% of that target has been reached. Even among the 60 plus, the vaccination of even the first dose has only reached 50%. That means there's a huge chunk of even the most vulnerable population that is still remaining to be vaccinated. So I think it's a time to rethink whether it is a right strategy to, go on distributing these limited vaccines to everybody, or is it time to really, take a step back and then perhaps vaccinate only, distribute these limited vaccines
So
to the
time to
most
reassess
vulnerable?
given the limited means that we have in the situation and the fact that we
Exactly.
know that a third wave is possibly impending. But Professor John, I want to ask you about this Kerala paradox now. You have Kerala with a large vaccine footprint, but new infections are also rising at the same time. Over the last 2 days, Kerala has reported a significant rise in new infections.
Yes, well, I don't want to call it a paradox. There are many reasons why I'm not really surprised the way the spike is happening in Kerala now. I wouldn't actually call it a spike. Actually, it's actually in a plateau. In fact, this was the same situation that Kerala had faced after the first wave. Also, it had a very extended period of almost 1 to 2 months of a plateauing of cases at around 5,000 cases average for about a two months period. And that's exactly the same thing we're seeing now, of course, except that now it is at a higher plateau compared to the previous plateau that we experienced. And also we need to notice that, this particular wave of the pandemic started in Kerala much later than it started in many other states. For example, by the time Kerala had started seeing surge in cases in this particular wave, there were states like Maharashtra, Madhya Pradesh, Gujarat, UP and many other states which had already started experiencing this surge.
Sure.
So it was almost 1 month later that Kerala actually started this wave. And so I believe, it is also the last to complete. But obviously, I'm not seeing that it is going down completely. It is going to be on a plateau. And it has to be also seen with the fact that Kerala has a lower proportion of the people who are actually having seropositivity as per the third ICMR sero survey. That's the latest we have. And it was only 11% at that time in Kerala population, when it was 21% for the national average. So it means there is a larger percentage of susceptible population out there in Kerala still now. And that is also partly explaining why the cases are still on a plateau and it's not really coming down. And the last 2 days, as you said, this slight increase that you saw is partly a factor of increased testing also. We have seen a rising in tests in the last couple of days, and that is the reason why you also see a higher cases reported in the last couple of days.
But you took the example of how Kerala went into this phase after the other states, but we're not seeing the same being played out in the states that you mentioned. Dr. Jamil, where do you stand on this? Professor John said it's not a paradox. He doesn't want to really call it a paradox, but isn't that what it is? Because you have a state which has the highest vaccine coverage in India and the highest percentage of population that's fully vaccinated, but still you're leading in new daily cases. How do you explain this?
No, so I do agree with Professor John. And before I go forward, let me compliment him for all the fantastic data that he puts out on a daily basis. I follow that very regularly for my own understanding.
As do I follow him on Twitter.
Yes. Well, I'm not on Twitter, but I go just to follow him. It's not a paradox because Kerala did so well in the first wave and also in the second wave that it still has a lot of unexposed people. And if you have unexposed people, you will get them infected. Remember, vaccines will prevent severe disease and hospitalization. Vaccines are not preventing symptomatic disease.
Correct.
And if you see the mortality rate in Kerala, the mortality rate in Kerala is about 2.5 times less than the national average mortality. So I think it gels very well with what's happening. So I'm not surprised at all. It would, however, be still advisable that people continue to wear masks and all of that. And I'm, coming to the vaccination situation in the country and how many people have to be vaccinated, I must say that I'm a little disappointed that we don't still have the next zero survey.
Yes.
The last zero survey was in September last year.
All right. Absolutely.
We should have known by now how many people got infected in the second wave. And that would give us a fairly good idea as to how much more vaccine coverage is needed. I really think that ICMR should be focusing on developing better tools to do sero surveys, doing sero surveys. It is not the job of ICMR to look at buying drones to supply vaccines to remote areas.
Well said.
That is the job of ICMR. They should be doing that.
Thank you, Dr. Thank you, Dr. Jamil. Thank you, all of our panelists tonight. Well, we do have a new health minister, and possibly the most significant element of the significant change of Wednesday's cabinet reshuffle, perhaps the closest we've come to this government acknowledging that we were ill prepared for this deadly second wave. But with a new health minister, maybe we can see some changes. Maybe we will look back. Maybe we will learn from the second wave, look for zero surveys, and think about what we need to do to prevent a third wave. Thank you all for joining us. Thank you all for giving us a reality check tonight.